Why do cats die suddenly? It's a sad fact that our beloved cats will die one day and leave us. But what's sadder is if they die suddenly, despite being well and healthy. This is a serious and very critical topic to discuss. So bear with me in this video as I share the most common reasons why cats die suddenly. Heart disease. Heart disease in cats can sneak up without warning. Some cats might have a heart murmur in their past, but others seem completely healthy. Yet some signs could still show up. They might play less, sleep more, eat less, lose weight, or breathe faster. Sometimes a cat might seem perfectly fine one day, but then get very sick very quickly. Cats with heart problems might struggle to breathe or use their back legs, which can make them cry out in pain. The most common heart disease in cats is called hypertrophic cardiomyopathy, where the heart muscle becomes too thick. Another danger is feline heartworm disease, which can also lead to sudden death. Feline leukemia virus. Feline leukemia virus is a major reason why cats die suddenly. It spreads through contact with infected saliva, blood, or poop. Kittens can also get it from their infected mom even before they're born. Most cats exposed to the virus don't get sick, but some can develop cancer called lymphoma, which is common in cats with this virus. They can also have other health issues like anemia, infections, and blood clotting problems. Cats with feline leukemia virus are more likely to suddenly pass away compared to those without the virus. If your cat has leukemia virus, it's crucial to keep an eye on their health and take steps to keep them well. Trauma. Accidents or fights can lead to trauma, which can be really bad, like broken bones or even death suddenly. Animal attacks, getting hit by a car, or falling from a high place can cause serious trauma. Trauma often leads to internal bleeding or organs failing, which can be hard to notice, especially because cats tend to hide their injuries from us. Heart failure. When the heart can't keep up with the body's needs, it's called heart failure. This usually leads to fluid buildup in the lungs, making it hard to breathe. The main cause is a heart condition called hypertrophic cardiomyopathy. Signs of heart failure include less interest in eating and playing, and breathing faster than usual. Some cats might pant with their mouths open when they're really struggling to breathe. Cats are good at hiding their symptoms until they're very sick and need urgent help. Infectious intestinal disease. This is also one of the biggest reasons for sudden death in cats. One common type is called feline distemper, or feline panleukopenia, which is caused by a virus. This virus inflames the intestines and causes diarrhea. In serious cases, it can even lead to death. Feline distemper spreads easily and can pass from cat to cat through infected poop or vomit. The best protection against it is to get your cat vaccinated. Sepsis. Sepsis, also known as blood poisoning, is a severe infection that affects the whole body. It's very dangerous, with a death rate ranging from 20% to 68%, even if treated quickly and aggressively. Sepsis can happen due to a primary infection or trauma, like when the intestines burst and bacteria and poop spread into the body's spaces. This infection spreads through the blood and affects everything. If it gets worse and leads to septic shock, the chances of surviving become even lower. Because sepsis can quickly get worse, cats can die suddenly from it. Feline lower urinary tract disease. This happens when a cat's urethra gets partially or fully blocked, showing signs like peeing often, blood in the urine, and difficulty peeing. Sometimes it can lead to sudden death because of high levels of potassium due to sudden kidney failure. This disease used to be called feline urologic syndrome. The blockage usually comes from crystals or mucus in the urine, often made of a substance called struvite. Sometimes it's caused by a bacterial infection. Cats most at risk are indoor, overweight, and between 2 to 6 years old. This disease is more common in winter and spring, and it doesn't favor any particular sex. The chances of dying from lower urinary tract diseases range from 6% to 36%. It can also lead to long-term kidney problems. Factors like diet, water intake, and urine pH affect the formation of struvite. During examination after death, a blockage in the urethra may be found. often made of tiny crystals mixed with organic material. Cats with urinary tract diseases may also have blood in their bladder. Poisoning. The Journal of Veterinary Cardiology looked at 252 cats that died unexpectedly within 2 months. Poisoning was found to be a major cause of death during autopsies after these sudden deaths. Out of the 252 cats, 158 died at the vet clinic due to suspected poisoning. Cats can get poisoned by eating, breathing, or touching harmful substances. Many foods and plants that are safe for us can be toxic to cats. Things like garlic, onions, and chocolate, which we commonly eat, can make cats sick. These toxins can even get into a cat's body through their skin if they come into contact with sprays, oils, or airborne particles. A cat might lick these off its fur, which can also make them sick. Sadly, some people deliberately poison cats, not always by accident. This is one of the reasons why vets suggest keeping cats indoors or providing a safe enclosed space outdoors to protect them from harm. Toxins. Outdoor cats are more likely to ingest or come into contact with toxins and medications, but indoor cats can also be affected. Common toxins include antifreeze, potpourri, medications containing acetaminophen, poisonous plants like Easter lilies, and ingestion of rat poison. Meningoencephalitis. Meningoencephalitis is a swelling in the brain and its protective layers, caused by various viruses, bacteria, or parasites. Sadly, it's often deadly for cats, and there's no known cure. Treatment aims to ease symptoms and support the cat's breathing and heart functions. Meningoencephalitis is a severe illness that can lead to sudden death in cats. If your cat shows any signs of neurological issues like seizures or unusual walking, it's crucial to take them to the vet right away. Early detection and treatment offer the best hope for survival. Choking. Choking happens when something blocks a cat's airway, like the trachea. Just like in humans, cats can choke on food they inhale, leading to a blocked airway. This can result in sudden death because the blocked airway prevents air, and therefore oxygen, from reaching the lungs and brain. Having knowledge of basic first aid for cats is crucial because knowing how to help a choking cat can save its life. A cat can die from lack of oxygen due to choking in just a few minutes. Chronic kidney failure. Chronic kidney failure is quite common in older cats. It can be caused by different things like inflammation of the kidney filters, glomerulonephritis, protein buildup, amyloidosis, kidney tissue death due to lack of blood supply, infarction, kidney infections, pyelonephritis, bacterial infection, leptospirosis, formation of stones in the urinary tract, urolithiasis, and exposure to toxins, nephrotoxicosis. Symptoms can include weight loss, increased thirst and urination, poor body condition, and a type of anemia where the body doesn't make enough red blood cells. During examination after death, the kidneys are often small, oddly shaped, and have areas where the tissue has died due to lack of blood flow. Stroke. A stroke is a term often used when someone has a brain problem due to a lack of blood flow, known as a cerebrovascular accident. This happens when something interrupts the blood supply to the brain, stopping nerve signals from getting to the rest of the body. Strokes can happen suddenly and can lead to sudden death in cats. Signs of a stroke include trouble walking, weakness, falling to one side, paralysis on one side of the body, or seizures. Hepatic necrosis. Hepatic necrosis is when liver cells die and are replaced by scar tissue. Liver disease is the most common cause, which can result from various factors like infectious hepatitis, cancer, and toxins. Treatment often involves surgery to remove the damaged liver tissue. In severe cases, a liver transplant may be needed. Bite from a venomous animal. Venomous animal bites can be more or less common depending on where you live. In America, snakes like rattlesnakes, copperheads, and cottonmouths are native and can cause rapid death if they bite a cat. Even if the bite doesn't inject venom, it could still be fatal to a cat. A severe bite to the face or throat can cause extreme swelling, blocking the cat's airways. Different types of venom can cause different symptoms. For example, neurotoxic venom can lead to seizures and paralysis, while hemotoxic venom can cause bleeding inside and outside the body. A cat bitten by a highly venomous animal will likely die quickly without anti-venom treatment. If your cat shows any symptoms mentioned in this video, please take them to their vet or any clinic that's near you. I hope you find this video helpful and see you on the next one.